I'm Cassandra, and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. September marks National Atrial Fibrillation Awareness Month. It's often called AFib, and it's a heart condition people might not know a lot about unless they've personally experienced it or know someone who has. We wanted to hear directly from community members to get their thoughts on AFib and heart health, so we headed to Memorial Park in Appleton to chat with them. What do you know about atrial fibrillation? It's also known as AFib. Have you ever heard of that?
I have, and I should know.
I've got siblings that have that, 3 siblings that have that, but I've never looked into it for myself.
You know, it can happen at any age. So I think from a preventative standpoint, really making sure that you're doing everything you can to stay active and keep that heart healthy.
It was inspiring to hear people's thoughts and experiences on this important topic. AFib affects more than 5 million adults in the United States, and according to estimates, that number is projected to increase to 12 million by 2030. 2 cardiology experts join us to explore the rise in AFib and discuss prevention, risk factors, symptoms, and treatments. Joining us first today is Dr. Babar Parvez. You are a clinical cardiac electrophysiologist. That is a mouthful. So what do you do, Dr. Parvez?
So a cardiac electrophysiologist is a heart rhythm specialist. We deal in helping patients with all manners of heart rhythm issues, fast heart rate, irregular heart rate, slow heart rate, and in some situations, almost no heart rate.
Okay, so you see a wide spectrum of patients coming in.
That's correct.
Okay, so today, to learn more about AFib, we've constructed a quiz-style game show, if you will say, and we're going to go through some questions, and we're going to talk about AFib. And how we've structured this is we're going to answer the who, what, when, where, why, and how when it comes to AFib. Does that sound like a good plan?
Sounds like fun.
Okay, let's go ahead and take a look at the first question. What is atrial fibrillation, or AFib?
Yes.
So irregular heart rhythm, rapid heart rhythm, poor blood flow within the heart, or all of the above?
It's all of the above. Irregular heart rhythm is exactly what AFib is. A normal heart beats 1-to-1. The top beat, squeeze the blood down to the bottom chambers, and then the bottom beat, and then squeeze the blood to the rest of the body. So it's like walking one step after another. Atrial fibrillation is quivering of the top chambers, irregular beating, where the top chambers don't necessarily completely squeeze or effectively squeeze. So that causes irregular heart beating. It's not 100% always fast heart beating. Irregular atrial fibrillation can be normal heart rate, where the person checks the pulse and it is normal. Mm-hmm. It is still AFib, still concerning, and it is normal. And then there are some patients that actually present with a slow heart rate. But predominantly, vast majority, I would say over 70%, come with a fast heart rate.
Is it possible for somebody to have no symptoms at all?
It is possible, and we do see that. And those are the ones, unfortunately, we worry about the most because they are the most at risk for stroke. So even in those patients where they don't have the conventional symptoms, weakness and exhaustion is one thing that I tell everybody to look out for. Mm-hmm. If you are overtly feeling exhausted consistently, mm-hmm. when you were not before, get yourself checked out.
That's good advice. All right, let's take a look. Our next question is, who is at risk for developing AFib? A, people 65 years and older. B, people with a family history of AFib. C, people with underlying heart disease or other medical conditions, or all of the above?
All of the above. It's everybody. We have patients in their early 20s with atrial fibrillation. In this part of the world, 65 and above is common because that's where people have already accumulated a number of other health issues, diabetes, hypertension. Obesity is very prevalent, and with obesity comes a lot of health issues, including sleep apnea.
What are the risks of leaving this untreated?
When you have atrial fibrillation untreated, going on and on, strokes start happening, heart muscle starts becoming weak, neurologic strokes start happening, blood pressure goes down, and ultimately people can expire.
Okay. When should someone seek care? A, at the start of symptoms. B, when someone in your family is diagnosed. C, if changes in your health are causing concern. Or D, all of the above.
All of the above. So if you are unsure, if you feel unwell for any reason, if you have a family member diagnosed, if you have any health ailment which puts you at risk for AFib, you can have yourself checked out. If you have a robust community healthcare system like ThedaCare is, which has been embedded in the community for 100 years, you don't have to go far. ThedaCare has many places you can go to, primary care, urgent care, hospitals. So all you have to do is go and ask for help. And for AFib, it doesn't require a very fancy test. A simple EKG can, at least in the moment, tell you whether you are in AFib or not. And then with your physician and through us, we can make a plan, an individual plan.
Okay. Next one up here, this is so interesting. It's which wearable devices can detect AFib? So smartwatches, smart rings, fitness trackers, or D, depends on the technology.
All of the above and depends on the technology. A mobile cardia is a device which is not a wearable device. You don't wear it. You touch it, and it gives you a EKG, and you see it on your phone, and your healthcare provider can see it on your phone. Apple Watch does the exact same thing. And then we can use it to tell you whether or not, while you were having your symptoms, was there anything going on with your heart?
Wow, it's incredible. Our next one up there, why are cases of AFib projected to increase? A, social determinants. B, physical and nutritional lifestyles. C, stress management. Or D, all of the above.
All of the above. On top of the A, I would even put which is the main risk factor, is age. Cancer doctors say live long enough, everybody will get cancer. Electrophysiologists like myself say live long enough, everybody will get AFib. Age is the biggest risk factor for atrial fibrillation.
Okay. All right, how can people treat AFib? A, medications and device monitoring. B, minimally invasive surgery. C, lifestyle changes. Or D, all of the above.
All of the above. The first two are things which others do to you,
Sure.
like your doctor. Your doctor will prescribe you a drug. Your doctor will recommend an invasive procedure. But lifestyle is something which is in your control. Be more physically active. We don't want everybody to turn into an Olympian. But we want you to be active. We want you to move around. Secondly is diet. Diet is good is because it's a long-term effect on the body. And unfortunately, that effect cannot be reversed overnight. So if you've been eating something on a particular way for 40, 50 years, like many people smoke, and all of a sudden they quit, the expectation that all those years of smoking and eating bad will reverse overnight, no. A moving train takes time to stop, and then to reverse takes almost the equal amount of time.
All right, Dr. Parvez, this has been really great information. We appreciate you explaining all of this to us so we can better understand what AFib really is.
Thank you.
We know that when it comes to heart health, prevention is so important. When we talked to people in the community about AFib, we also asked about heart-healthy habits. Tyler Wolf, a nurse practitioner with ThedaCare Cardiovascular Care, is joining us today. Tyler, thanks for being with us.
Thank you.
We're going to have you watch some of these questions that we ask community members. They talk about things they do to keep their heart healthy and maybe habits that they have, and we would like to get your reaction.
Okay.
All right, let's take a look at the first one. Our first question, what do you do to keep your heart healthy?
I try to go for at least a half hour, 40-minute walk every day.
That's a good answer. I like that. What do you do, Nancy?
Same here, walking.
Okay, so they said walking. Thoughts?
The more you walk, the more you exercise, whether it's aerobic, weightlifting, all provides benefit. It helps to reduce blood pressure, and also with the added benefit of adequate hydration, proper diet. These things can all contribute to reducing cardiovascular risk.
Okay, I think a lot of people might have this assumption that it needs to be like really intense workouts to get that benefit. That's not really the case though, right?
All options, whether or not it's to the level of intensity that someone else would want you to be, it still provides good benefit in the end.
Okay. Our next one here. What do you do to keep your heart healthy?
So usually I mostly climb.
Oh, okay.
And then I chase my kids on any playground that I can find, which is consistent.
And that's a workout in itself, right?
And if you make it really hard on yourself, yes. Like trying to take a 2-year-old up to the top every single time. If you lift them every time, it's just weights all day.
So he's not wrong, right? The more lifting you do, it does not have to be actual weights at a gym. My 2 twins are 35 pounds each. So when I'm at the playground with them and lifting them above my head, that's 35 to 70 pounds, depending on if there's 1 or 2.
Yeah.
So yeah, chasing kids, it's still aerobic activity. And then you include the weight into it. It's still going to provide cardiovascular benefit no matter what.
I love that. And it's something you're doing every single day. And, at least you're moving and getting your body active, right?
Yes.
Okay. All right. Our next question.
What do you do to keep your heart healthy when it comes to the food you eat?
Trying to make healthy choices. I'm not always easy with the kids, but my kids, for instance, think like frozen grapes as a dessert is a really wonderful thing, as an alternative to ice cream and things like that. So I think really getting them involved and teaching them about healthy choices is really important.
Very accurate. Trying to eliminate the saturated fats, refined sugars. Of course, you can have them in moderation, but focusing on lean meats, veggies, fruits, they can all help add to that reduction, cardiovascular risk for anyone. Doesn't matter what age they are at all.
Does it matter what type of diet that you follow? Are there ones that might be better for you?
Being in the cardiac field, we like to, at least myself, like to kind of provide people with more education as to a Mediterranean diet.
Sure.
It's healthy oils, a lot of veggies, some fruits. And then for meats, they do more lean meats. So we're thinking fish, chicken, turkey, stuff like that. You can always have some red meats. Steak is obviously very lean. So everything in moderation is kind of also what I preach to people.
What are some things that maybe you need to take out of your lifestyle that can help with your heart health?
Obviously, we all know that smoking is just a risk factor for a lot of things. So for heart health especially, if you can reduce your smoking or quit, it's going to provide overall benefit in the future. Other things like high consumption of alcohol, that can cause a lot of cardiovascular deficits down the road. We're not just talking about arrhythmias or heart attacks. It just can prolong other things, high cholesterol, hypertension, stuff like that.
What about stress? I think you always think people who are stressed maybe have heart problems. Is that true?
Stress can definitely affect the body negatively. If you're under a constant amount of stress, it can increase your blood pressure and just have your heart work more overtime than not. And if you have the ability to eliminate the stress, or at least control the stress factors in your life, it can help you to prevent any further heart disease from occurring.
What about sleep? Does sleep affect your heart health?
Yes, so lack of sleep is another cause of increased stress. If your body does not have the amount of rest needed, it cannot reset, recover. Importantly enough, too, people that have a lot of snoring, issues that cause them to not get a restful sleep can also impact your heart health. And it can cause other things like arrhythmias, like atrial fibrillation. So people that have a lot of snoring, or they have the partners that say, hey, you snore a lot. Those people, at least if they can talk to the PCP, would benefit from having a sleep apnea study done that can maybe diagnose them with obstructive sleep apnea.
So we were talking a lot about prevention here. How important is it to talk to your primary care provider before maybe a problem, like a larger problem, does occur?
Being proactive with your health and trying to at least establish with a primary care provider or seeing someone within the practice that may be associated with your actual physician, they can all provide some help no matter what. And unfortunately, if the problem were to manifest further, that's where the combination of maybe seeing a specialist has to take charge.
Okay. All right, Tyler, these have been great recommendations and tips. We appreciate you being with us.
Thank you.
And thank you for joining us to learn more about AFib. If you have any concerns about your heart health, just log into My ThedaCare to schedule an appointment with your primary care provider. We'll see you soon. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.